Greetings. I am Dr. Jeffrey Sterling, Surgeon General of Alpha Phi Alpha Fraternity Incorporated. This video blog discusses common sports injuries and how to avoid them. Athletes are at risk for injuries for different reasons than us weekend warriors. Although accidents happen to everyone, poor conditioning and training, propensities not to stretch or warm up, relatively poor playing conditions, and use of inferior equipment or lack of use of any at all make your adventures a little bit more risky. Here's a list of the more common sports injuries. You can go to Sphinx TV to look at discussions on individual sports injuries, but they include the following: strains and sprains, especially ankle sprains, knee injuries, bruises and other muscle injuries, Achilles tendon injuries, rotator cuff injuries, fractures, and dislocations. Of course, the most common injuries aren't all the rage. Everyone's concerned about concussions, and you can go to Sphinx TV to view a vlog on concussions. Unfortunately, the weekend warrior is too often engaged in the testosterone fest and doesn't listen to his or her body. If you get hurt, stop. If you don't listen to your body, something more serious could be on the verge of happening. Now let's discuss some tips to help you avoid sports injuries in general. First of all, always warm up, regardless of the sport. It's especially helpful to stretch your Achilles tendon, hamstrings, and quadriceps areas, and hold the positions without a bouncing motion. Avoid bending your knees past 90 degrees. Avoid twisting your knees. This is best done by keeping your feet as flat as possible during stretches and running. If you are jumping, try to land with your knees bent. Remember, cool down after vigorous sports activities. You want your heart rate to come down gradually. Be sure to wear properly fitting shoes. You can avoid stress fractures and sprains by wearing shoes that provide shock absorption and stability. Yes, those things are real, and you should seek them out. When possible, avoid running on hard surfaces like asphalt and concrete. It is preferable to run on softer, flatter surfaces. Appreciate that running uphill may increase the stress on your Achilles tendon and the leg itself. Again, remember to stretch beforehand. Know when to stop. Listen to your body. Use the RICE method of treating strains and sprains. Make a habit of this for even minor ankle, knee, wrist, elbow, and shoulder sprains. It helps with pain and swelling, and it also speeds recovery. The R stands for rest. The longer you stay off of an injury, the quicker it will heal. Conversely, the more you try to use it, the longer your recovery will take, and the greater the risk of aggravating the injury will be. I stands for ice. Apply ice for 15 to 20 minutes every hour over the first 24 hours. That will help keep the swelling and the pain down. However, please keep a towel between the ice pack and your skin. C stands for both compression and crutches. Use an ACE wrap for comfort and to help with the swelling. Use crutches to help you stay off of a sprained ankle. E is for elevation, and this is probably the only time I'll tell you it's okay to be a couch potato. Keep your leg elevated on the bed or on the couch at or above the level of your chest. That will help to keep swelling down. Look for additional content on Sphinx TV discussing steps that you can take to assist you in your health journey. I'm Dr. Jeffrey Sterling, Surgeon General for Alpha Phi Alpha Fraternity Incorporated. Thank you for watching.